Alright, so today we're going to be going over ventilators here. I talked directly to the state. I'm not sure what we're going to do with it yet as a service, but I will at least show you how to set it up. But I've talked to the state. EMTs can attach this to a patient. However, it needs to be preset, and again, we'll be working it out. But you pull out the bag, right? This is our ventilator bag. It's stored right under the bench seat there. And one of the big things that we need to worry about with this is there's the big oxygen requirement. These that carry 15 liters will not cut it. We want at least 25. So there's a couple options here. You can either use a portable one for the portable tanks when we're inside. This attaches just like a normal oxygen regulator, and it goes up to 25. And or there's another fitting which goes up to 25 here. I like these better. They're easier to use. So we want to get the right attachment on. To take these off, it's a twist and pull, and you pull it right off the wall. Again, we want to use this one, so I'm going to attach it. I line up the knobs, and I push right in. And we also won't need this Christmas tree, so I'm going to take that off. Okay. So, we pull the ventilator out of the bag now. And again, if we're setting this up in a house or in the ambulance on a code, there it is. Vent circuits, another thing we need. Use this on a patient. This is good for practice. But so we got two different lines here. The white line is going to go directly to the patient, and the green line lines up with the oxygen. Oxygen's green, and it hooks in right to the bottom of this. You screw it in all the way. And again, if we end up as a service allow EMTs to set this up on a patient, this will be preset, and you will not touch it. This is set for a patient prior, but I'll just show you here. It'll be set to whatever rate and depth that, if we decide to do it, to set it at. And again, this goes to a patient. So, the white part goes over this. And if you're taking, rare occasions you may have a PEEP valve, but that's a whole other thing. That's what that piece goes to there. This bottom piece is going to go directly to the adjunct, like a King airway or an ET tube. Fits right in there. And again, we want to have some end tidal monitoring on there. So hit the end tidal in there, and then you can connect it directly to the tube. And all it takes to turn it on is to simply turn this all the way up to 25. If you listen here, it's now breathing 12 times a minute, like I have set, in the adequate rate and depth. And it's just going to breathe through the patient. That easy. It's preset. You just hook it up, have the right adjunct, and turn it up to 25.